Welcome back to Cablevision's Hudson News Edition. I'm Sherry Carabin. With winter in full swing, some people may not be feeling as perky as usual. You may think it has to do with the cold, but in reality, the answer is a lot more complicated. Dr. Gabriel Kaplan, Executive Director of Behavioral Health Services at Hoboken University Medical Center, joins me now to shed some light on the problem. Thank you for being here.
Thank you for having me, Sherry.
Now, if you're feeling a little down right about now, what could be causing it?
Well, you just hit the nail on the head a couple of minutes ago, and you talk about shedding light, and that's exactly the root of the problem. People refer to winter blues as a mild depressive condition that takes place when the days get shorter. It seems to have to do with how much light and natural light one is exposed to.
Is this the same thing as seasonal affective disorder?
Well, actually, the winter blues is a milder form of seasonal affective disorder. Winter blues occur when people have difficulty getting up in the morning, they're really tired, they tend to eat a lot, and that happens during the winter months. Many times that goes away in the spring. For people for whom the usual remedies for this doesn't work very well, then they need treatment for seasonal affective disorder, which is a more severe form of winter blues.
Also caused by the lack of light?
The lack of light. And so for people who have the winter blues, just going out, staying out a little bit more in the sun, working close to a window, exercising more, those things may just take care of the problem. If you feel that doing that doesn't work for you, a consultation with a professional is recommended. And there are forms of fairly simple treatment where one is exposed to artificial forms of light that mimic the natural light, and in that way you get compensated in a way for the absence of the shorter days, and then get improving in your mood.
How is this different from full-blown depression?
Well, it has to do with severity. In seasonal affective disorder, the illness tends to be more circumscribed. Major depression or clinical depression is something that can hit you anytime, in the summer, in the winter, in the fall. It really doesn't obey the seasons, and it can be a lot more severe. People can be as ill as feeling that they wish they were dead. Sometimes they lose touch with reality, and being out in the sun or exposed to the light is not going to work. What you need in those cases is really a consultation with a professional, and sometimes you need medication to get better. The treatment has to do and be a lot more intensive. Now, with the winter blues, it's interesting, roughly about 5% of the population gets that. So in the winter, many people around you, your coworkers, might start feeling a little bit different. They might be down. And so this is something that they can do, very simple, not getting into very expensive consultation, but just be out there, do more exercise, and be out in the sun.
And if possible, move your desk toward a window?
That sometimes helps if you get closer to the light. Southern exposure seems to be the best part of it.
If you're not sure, should you see a doctor?
Absolutely. When you are in doubt, and if the symptoms are not getting better with these simple remedies, it is absolutely essential that you consult with a doctor, because the consequences of untreated depression can be very severe.
Well, thank you very much for joining me here today to talk about this.
Thank you.
And if you would like more information on the winter blues or seasonal affective disorder, you can call 201-792-8200. And don't go away, because we'll be right back.